Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good afternoon, everyone who is listening this program. I am Dr. Eijaz Bhat. I am a consultant neurologist based at Srinagar.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, our brain is controls our body through various electrical activities. So, at any point of time when this electrical activity becomes excessive and abnormal, so it results in a seizure. It will affect our body in many ways. It can cause abnormal body movements. It can cause loss of consciousness. It can cause abnormal behavior. It can cause a stare-like situation. These are the ways by which a seizure can affect a human body.
What is epilepsy?
Epilepsy is a medical condition in which a patient has recurrent seizures. Generally, there is a definition for epilepsy that when a patient develops two or more consecutive seizures more than 24 hours apart, we call it as an epilepsy. So, an epileptic patient has multiple seizures. They may be of one type or multiple types. When a patient develops multiple seizure types or multiple seizures, he is called to be an epileptic.
What are the different types of seizures and do they affect people differently?
Yes, seizures are generally of three types. One is a focal seizure, which arises in a particular area of brain and remains confined to that and will affect only that part of the body. And second is a generalized seizure, a seizure which will arise at a time from all the areas of a brain. And third is a secondary generalized seizure, in which seizure arises from one part of the brain and then it spreads to the whole brain. So it can affect differently as per the part of the brain involved. If a focal seizure happens, a focal part of the body is involved. If a generalized seizure happens, the whole of the body will be involved.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, we cannot always find a cause for epilepsy. There are some cases where a cause of epilepsy cannot be established, but there are certain causes which can range widely, right from patient can have a tumor, patient can have a trauma, patient can have a stroke, patient can have sometimes genetic causes of epilepsy. So, epilepsy can appear or can happen to a patient without an obvious cause or with some obvious cause.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
The signs and symptoms of epilepsy will include that of a seizure, which may include the abnormal movement of a part or a whole of the body, or abnormal behavior of a patient, or loss of consciousness, or loss of memory issues. These are the signs and symptoms a person should look for in a patient who is having a seizure or an epilepsy.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often
See,
misunderstood?
since long, long times, people who have epilepsy have been associated with this stigma of epilepsy. The reason being that initially or even today, there are many parts of the world or country where people don't recognize it as a neurological condition. They recognize it as a something abnormal, which is supernatural. So that's why there is a this stigma associated with this epilepsy.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
There are triggers, different triggers for different patients. The common identifiable triggers include missing sleep, stresses, skipping meals or skipping foods, flashing of lights, fever or illnesses, and this missing the dose of anti-epileptics is a very common trigger. And sometimes females during menstrual cycles or during pregnancy have hormonal changes that can also trigger epilepsy.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, any patient who is suffering from seizure or epilepsy should take care of his household goods like sharp objects should always be on the sides, tables should always be covered, their edges should not be sharp, and the same person should not be allowed to handle the such items which are injurious like knives, glass objects, or should not be allowed to work at heights or should not be allowed to go close to the deep waters so that the patient could not harm himself or herself when the patient suffers from an epileptic or a seizure attack.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
Yes, I have two things to say. First thing is that we should not associate any stigma associated with epilepsy, and any patient who is having epilepsy or seizure disorder should sought medical attention. Number one. Number two is the treatment. Since the treatment of epilepsy is a bit longer, patient has to take anti-epileptic for some years. So we should always educate the patients to be compliant to the drugs so that they take the drugs for the complete course of time and they will not suffer of due to it, because if patient does not take drugs regularly they will suffer from drug resistant epilepsy, then the drugs will also not be helpful for them. Thank you.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.